on the foundation for the younger generation, on the foundation for the younger generation, for the younger generation, on the foundation for the younger generation, on the foundation for the younger generation.
Hello, dear listener of Youth Drive on Foundation Radio. I welcome all of you sitting in front of their radio to listen to this wonderful educative program brought to you by Youth Irish Program, a community-based organization situated at My One Up Station. During this 1 hour program, we are going to tell you, we brought to you a new topic on maternal health. So how can we improve maternal health in order to reduce maternal mortality or that leads to child mortality? So today we are going to talk about the causes, the method of the measure we can use in improving maternal health. So you can call me Bukenina, your presenter, and with me in this studio are my two great colleagues.
Franziska Rossnagel, hello.
Hi everyone, I'm called Eric Mboteji. I'm always very thrilled to be with you guys, and you guys were waiting right for the Youth Drive jingle. Thank you very much for being there.
Okay, thank you very much, Franziska and Eric. So, dear listener of Youth Drive, we invited a resource person to come and share her experience as a young mother. She just gave birth to a child, and we want her to come and tell us what was she doing during her pregnancy and after her pregnancy. What is she doing to take care of herself and then take care of her child? So I want her to present herself. Can you please, our resource person, present yourself?
My name is Kind Comfort. I am a nursing mother. My baby is 7 months, 2 weeks old.
Wow, we are very happy to have you here on Youth Drive today. It's very unusual because we usually have resource persons, but you are one of a kind, special. Okay, dear listeners, it's always time for us to, like I say, good music brings good mood. So let's start this show by introducing to you Jennifer Lopez and Liwen Pitbull, sorry. And the title is On the
Foundation for the younger generation, on the foundation for the younger generation, on the foundation for the younger generation, on the foundation for the younger generation, for the younger generation, on the foundation for the younger generation, on the foundation for the younger generation, on the foundation for the younger generation.
Welcome back into the studio. You were listening to J-Lo and Pitbull. You already know maternal health is our focus of today. This topic is one of the 8 Millennium Development Goals set down by United Nations and other governments during the World Summit in September 2000. So what do we understand by maternal health? I would say we are talking about the health of mother and child during the pregnancy,
or
after the pregnancy and during the delivery. What would you say?
Okay, for me, maternal health refers to when a mother has a good health before and after her delivery. She has a good health, and then the child also is in good health. Yes, before and after the pregnancy. That's what I understand by maternal health.
For me, I think maternal health means the good condition of the mother when she's either pregnant with her baby, and the whole concept of maternal health is like saying that the woman should be in good conditions when she's pregnant, and after she has given birth to a child, they both should be pregnant.
Yeah, and we're talking about maternal health concerning medical treatment and antenatal. Yes, and the antenatal treatment.
And then maybe our resource person, Comfort, want to give her own view concerning the definition of maternal health. Do you have anything to say, Comfort?
As far as I'm concerned, maternal health can be there's the period from conception till delivery.
Okay.
How the mother feels and how her baby feels in her womb.
All right.
And after delivery. What the mother, the problems, that's how the mother feels after delivery and how her baby feels after delivery.
Okay, thank you very much. So, dear listeners, that was a brief definition of maternal health. That's the concept maternal health. You got the definition, and now we are going to analyze the purpose behind this Millennium Development Goal number 5, set down by United Nations in 2000 World Summit. So, I would like us to discuss which reason pushed the United Nations to choose and improve maternal health as one of its goals.
Okay, can I start?
What can be the reasons why the United Nations choose to treat the purpose of maternal health?
Yeah, like they say that women, they are the reasons why many people are here on earth. And so the United Nations conceived this very important goal because they feel that more women are not receiving antenatal care.
Yeah.
More women are not having basic information that, especially when they are pregnant with their children, they are ignorant of this kind of information. And when a woman is pregnant, she's in a very critical condition, and it's a kind of a very sensitive period for her to really take care of her body, where to go to, the type of medication she could administer to herself. So I think that the United Nations set down this very important goal because they feel that women should take up the challenge to make available or access all the informations that have been put to them. Even in the cases of where poverty limits them to to visit some of these facilities, the United Nations have they have made some subventions with especially the hospitals, the medical field, all over the world to ensure that these women get these services.
Yes, it is a challenge for the United Nations to reduce the long-standing disparities between urban and rural areas, or between wealthy women and poor women, and between adolescent, so young teenage mothers, and adult women. There are some disparities which are causing this high rate of maternal deaths, and all these maternal deaths are avoidable. Okay. So we should find out the reason.
Okay. So in conclusion, what I can say is that if the United Nations came out with this Millennium Development Goal number 5 on improving maternal health, it's because they noticed that when a woman gives birth, maybe between 100% of women who are giving birth, maybe 50% can lose their life during a delivery, or maybe due to a disease, a particular disease, the woman can just die during a pregnancy. So that's the reason why the United Nations came now to solve that problem of dying maybe during your delivery. So that's it. And then there are many girls who used to just fall into pregnancy because of lack of information on contraceptive.
Yes, education is one very important reason.
Family planning too.
Lack of advice. So United Nations is coming to improve on how young girls in our environment can be informed in order to avoid some unwanted pregnancies. You see, so that's what I think.
And also I think that negligence also is contributes to this. They neglect these things even when they know them. At times when the baby is kicking in the tummy, and things like that, they don't know they don't know what to do. They just know that they just need to have sex and then conceive a child and things like that, which is really regrettable.
Okay.
So
thank you very much. Before we should go deeply into our studio talk, I would like to
interview. Yes.
No, before we should interview our resource person gradually, I would like us to enjoy just another piece by Chris Brown and Simple in the title Brown Skin Girl. Enjoy the music.
When I want to please down for my name Chris Brown. Get on with the girl them from his hometown to out of town. I rush your walk, crush your butt, girl them not right for you. I got the right timing. Give you any style you require, make it temperature hot, make you know.
I am Kelvin Gwang Shemgong.
I am Moko Philemon.
I am Achu Sanji.
I'm Mokom Nova. I'm Mokom Sharon.
I'm Youth Stoba. I'm Lance Wetzstoffen.
I'm Patient Akwenja. I'm Yvonne Frinwe Takwe.
I'm Tala Adama.
Miss Mboringong Fideli.
I am Atujwe.
You are listening to Youth Drive on Foundation Radio.
On the foundation for the younger generation. On the foundation for the younger generation. On the foundation.
Hello, listeners of Youth Drive. This was Brown Skinned Girl by Chris Brown and Sean Paul. And now let us go on with our interview and our resource person. Let us find out more about the leading causes of maternal mortality in developing regions like different parts of Africa. So during the birth, it could get around to hemorrhages and hypertensions, which together account for half of all deaths in expectant or new mothers.
Yeah.
Indirect causes, including malaria, HIV/AIDS, and heart diseases, are also a problem. They are resulting more than 18% of maternal deaths. 9% are made by obstructed labors. That means complications with the anesthesia. You know, when you against the pain during the birth giving.
Mm-hmm.
Okay. So let us ask my resource person: did you have an anesthesia during your birth giving?
No, I never had anesthesia during birth giving.
So how was it standable for you?
So maybe she mean by some health problems during your pregnancy.
Yeah. No, I'm just talking about the pain.
The pain, no,
Yes.
the pain. It was just contraction, and after contraction, the muscles will relax. When this contraction starts, the pains increases, and when the contraction is reducing, it reduces with the pains.
Okay.
That was all what I felt.
Okay. So let us talk about complications, or I hope that there were no complications during your birth giving. Was there a doctor around who measured your pulse, for example? Or how did you experience your birth giving? How was it?
During delivery, it wasn't really all that easy because I had an epistocopy. That's a cut during delivery.
Right.
Okay.
That's on the passage of where the baby is supposed to pass. It was just because it was not that's the opening of the vagina for the baby to pass. It wasn't big enough for the baby to pass, so they had to do that epistocopy. For that reason, I felt pains.
You felt some pain?
Yes.
I felt some pain.
Apart from that.
And how did you manage it?
After delivery, it was sewn up, and then I was asked to use a detour, and that was all about it.
And was there a doctor measuring your...
Yes, I had a gynecologist.
Okay. Was it your first time in the hospital because of your pregnancy?
Yeah, that was my first time. That was my first experience.
Okay.
Comfort, I have some few questions for you. During your pregnancy, what were you visiting the antenatal care services?
Every month.
And what were they telling you guys to do? What were the information they were giving you? Things like that.
There you were told how to take care of your body, how to take care of your baby, because in a womb you have to take care of the baby.
That's very important.
That's the nature of food you eat.
Okay.
What is required of the baby? Always to pay attention to always listening whether the baby is kicking, because normally the baby is supposed to kick. If let's say 1 or 2 hours without you feeling the kick of the baby, therefore there's something wrong.
Were you doing anything like sports?
Yes, I used to. During the first few months of conception, I used to go for I do aerobic physical activities such as I play volleyball.
Oh.
I do I just take a walk.
Where does the strength come from?
It's not that the strength. I discovered that doing physical activities, I am always upright for my housework, maybe for my job.
That's amazing.
Yes.
And could you just tell us what were the kind of foods that you were eating? Because I might presume that you had some specific food supplements,
during that period.
Condition.
Yes, during that period, I made sure I tested a bit of everything.
Oh, really?
Except I
nice.
tested a bit of everything,
Okay.
except orange. That was really making me nauseated. That's feeling like vomiting.
Yeah, nausea.
Yeah, nausea. That was the only thing that really disturbed me. But though I was eating some food, when I eat, they'll give me heartburn.
Mhm.
But I was advised by my doctor to drink much water.
All right.
When I drank, I discovered that drinking much water, maybe at least 3 to 4 liters a day, the problem was reduced.
Okay, so one antenatal care was the right nutrition.
Yes.
That was important for
That
you.
was very important.
And movement.
Yes.
And okay. And the kind of medical treatment, how many times did you visit the hospital?
It was after the first 3 months of conception, I just decided to start my antenatal clinic. From there, I was given calcium marks.
Mhm.
I was given ferro, that is fetorate. That's that's a drug for iron.
Okay.
That will
Mm,
increase
yes.
the ionic.
Yes.
Yes,
Iodine,
yeah.
iron.
That will increase. That's my blood
All right.
level. Yes,
Okay.
that was the type of drug that I was given.
Okay, Comfort. Thank you very much for that clarification. I would like you to tell us a little bit on how you were feeding, because you told us that your child is 7 months old today. I would like you to tell us, how are you feeding your child? Which type of food are you giving to your child, and what are the reasons why you choose to give those particular food to the child?
From birth, I was giving her breast milk. I've never given her any other food. Till 6 months, I started giving her. I introduced artificial milk alongside breast milk.
Okay.
I was giving her pap. I'm giving her pap because it's what I'm doing now. I'm giving her pap. Then at times I'll give her fufu corn and okra soup, because I discover she's not really fond of eating pap. She likes eating what you eat, but I have to be selective because not all that I eat is good for the baby.
Okay, let me give us some information. You had big luck, Comfort, because yes, the majority of these deaths of young babies are avoidable. Hemorrhage, for example, which accounts more over than 1/3 of these deaths, can be prevented or managed through a range of interactions administered by a skilled health or a skilled health provider with an adequate equipment and supplies. So you had luck with your medical treatment and with your doctor, and you had somebody who was telling you how to treat yourself during your pregnancy.
Yes, my doctor, the gynecologist who did the follow-up, was really the one who was advising me on what to do, the type of food to eat, what to do when, let's say, during, towards the period of delivery. As an expecting mother, you're supposed to be waiting when this happens. Let's say if you feel, let's say, constant contraction and you feel, they always say you see blood and catarrh, like
mucus.
Mucus. That you're supposed to just start rushing to the hospital. I think that was what I was advised.
So serious disparities are also found. That is also a problem we have to challenge, or the UN is trying to challenge. Serious disparities are found between the wealthiest and the poorest households in many developing countries. For example, in sub-Saharan Africa, where the wealthiest women are 2 times more likely, respectively 3, as the poorest, to be attended by trained healthcare workers at the delivery. So it is much more likely to get a good medical treatment during the delivery when you are wealthy or when you have money. So what would you say? Somebody wants to contribute something about that.
So that question leads us to the causes, the general causes or the basic causes of maternal mortality. What are the basic, Eric? According to you, what are the basic causes of maternal mortality?
Yeah, one of the first basic causes of maternal mortality is negligence.
Yeah.
Like our resource person here rightly said, she discovered that immediately, after 3 months of conception, she was already informed that she had to be going to the hospital to be attending antenatal care services. But most young women or pregnant women who are in this situation, they wait for about 6 months, or they don't want to go at all. They don't want to. Maybe they are ashamed that people will see their stomach protruding, and they don't want people to know around that they are pregnant. And so this issue of negligence kills makes most mothers and young girls who are pregnant to be die exposed. At home. And you even see cases like they will wait until the pregnancy is at hand, and then they end up giving birth at home, which is not unhealthy. You just find people can just be rushing there, coming to do whatever they think is right at that moment. So I think that one of the basic causes of maternal mortality is negligence and lack of information.
Yes. And there are also disparities between different regions, the urban regions and the rural regions. That means people who are living in villages far away from town. So
they don't have health facilities to take care.
Yes.
Yeah, but I would like to say that there are midwives in these localities, you know. There are midwives, and there are some healthcare services, there are some health clinics, not actually hospitals, but they have been fine-tuned in such a way that it provides these services for women to come there and give birth to their children.
I can equally say lack of road infrastructure. That's the main problem, because when a mother, that's an expecting mother, is at labor, she finds it difficult to trek. If the transportation means is not there, she may likely deliver at home.
Yes.
She may not be able to reach the hospital.
Yeah, that's very sad.
Yes. So let us come to the next point. Let us talk about teenage pregnancies, or about preventing young mothers from maternal deaths.
That's too.
No, I mean,
I'm trying to. Okay, go ahead.
This is causing teenage pregnancies are causing a lot of maternal deaths.
Of course.
And so, what could be the reason for it?
The issue is that there are some girls that maybe adolescent girls who the system, their body is not ready to carry a child.
Yes.
So she can go somewhere and they rape her, or maybe she can, or as they used to say that I have my boyfriend or I have my girlfriend.
Right.
So when they go into sexual activities or relation, they don't know what will happen during that sexual activity. So the girl can easily carry a baby there, while her system is not yet ready to carry a relevant or a baby. So that can affect the girl, and it can easily cause death during her delivery.
The adolescents in general, they face greater obstacles than adults to get the knowledge about different things. And to access reproductive health services and things like that.
Yes, I know. You know, Franks, when young girls are pregnant, first of all, they don't want to access these services because they are shy. They know it's wrong to be pregnant. You know, for most of them, if they discover that, if their parents discover that they are pregnant, they know that they are going to kill them, something like that, in quotes. That's why at times they turn to crude means, you know, of abortion. They don't even go to the right people. They just turn to other people who can just remove the pregnancy, so that nobody in the family finds out, you know. So, and in the course of doing that, if you're not a specialist, and then, of course, your life can be terminated just like that. So I think.
And then we also have the lack of education, which is one of causes of, because a girl who is educated knows that when she's pregnant, she has to go to the hospital every time to carry some medical checkup in order to secure her life and secure the life of her unborn child. So for me, education is also a reason why a girl can fall into pregnancy and also die.
Nina, can I ask you a question? We are talking here about teenage pregnancy, First of all, these teens, they know that getting pregnant at that early age, that teenage age, is wrong. And so they'll be very shy, you bear with me, Francie, to access these healthcare services, to go in for checkups, because they don't want people to discover their protruding stomachs. They want to conceal it from people. And so they will not. Most of these young girls, they are students, which means that they are very educated. But when they find themselves in these conditions, they don't want to access these services, which they know, because they know it's wrong for them to be in that situation. And also that if their parents find out, of course, it's going to be hell for them. Yeah.
And the UN found out that girls with secondary education are the least likely to become mothers. So it is a fact, unfortunately.
So, dear listener, before we continue with our studio talk on maternal health, I would like to introduce another track by
Wiz Khalifa, and the title is Black and Yellow. Make sure you enjoy.
Youth Outreach Program Cameroon.
Founded in 1993 as a youth association.
Started functioning in 1995 and strongly committed to working with young people,
fighting poverty and inequalities in their communities.
Our vision:
we seek a Cameroon where all young people
contribute to the development of their communities,
gain and share valuable skills vital for adulthood,
live healthy lifestyles,
have equal opportunities.
Our mission:
empower young people with skills needed to make informed decisions,
thus creating a better society where they are healthy,
responsible,
and actively involved in the development process.
Youth Outreach Program:
developing skills,
enhancing capacity,
building the future.
Youth Drive
on the foundation.
Youth Drive
for the younger generation.
On the foundation for the younger generation.
Welcome back to You Drive on the Foundation Radio. Ladies and gentlemen, you were listening there to that thrilling piece of music by Rihanna and Chris Brown entitled Umbrella. And shortly after that, you heard our Yup slot. As you already know, You Drive is a weekly educative program brought to you by this organization called Youth Outreach Program. And youth outreach programs activities are centered around community education and youth empowerment. As a reminder, our topic of today is the 5th Millennium Development Goal, that is improving maternal health. Francie, maybe you have some things to add.
Yes, I want to talk about another point. Thank you, Eric. About so another method of the United Nations to gain the reduce of maternal deaths on the world is to improve family planning and to use things like abortions. So in order to improve family planning, contraceptives, which means birth control methods. It is an umbrella term for techniques to prevent fertilizations or to interrupt pregnancies, including abortions, for example. So is that a method you would like to discuss about?
About abortion?
Yeah, about abortions. I mean, for teenage or adolescent mothers who would be unable to care for the baby. So about involuntary pregnancies. So should we? I mean, there are some regions where abortions are still not allowed.
Yes, even here in Cameroon.
Cameroon is forbidden.
Yes, and I think that abortion is not a very good term. No matter how sweet it sounds, abortion.
Abortion.
Yeah, it's crazy, you know. And of course, that's I realized that the first idea that teenage girls, when they are pregnant, that's the first thing that comes to their mind. And so they are not always thinking of doing the abortion the right way. Of course, if you're raped in the case, and in Cameroon, if you are raped, you have the right to go and say, I don't want this baby, because you don't know the perpetrator of such acts. You don't know what the baby will come out to be and things like that. So you have the right to go and they will do
a safety
test. Yes,
abortion.
A test, yeah. But on the other hand, my sisters out there who are having themselves in unfortunate situations because of uncontrolled emotions, they decide to do it the other way around, which is pretty dangerous. So I would deny and I will cancel this fact in their mind that abortion is not advisable for young women. But in the case where you found yourself in that situation, it's always good to seek advice from the right people, especially from the medical field. That's what I think.
So thank you very much, Eric. Before we end this program or continue with our studio talk, I would like to ask this question to our resource person, that is Miss Comfort. So Miss Comfort, can you please, or maybe which type of advice can you give to young girls who are pregnant out there, or maybe young mothers who have just given birth, who have just given birth to their child? So what can be the advice you can give them so that they should take care of their body in order to avoid mortality?
Yeah, because she's the right one to give advice. She has a very sweet, cute baby.
I would like to advise young mothers or expecting mothers out there that immediately you discover you're pregnant, that it goes to young girls also. Immediately you discover you're pregnant, it's always good to go for checkup. When you go for checkup, your health is safe, your baby is safe. Because when the doctor checks you, he knows the state of your baby and you, the expecting mother. I would also like to tell expecting mothers and young mothers that it is good to give exclusive breast milk to our children, because we may not know what may come in. Some of us breastfeeding mothers, some of us are very careless, such that you may like to interact your baby's feeding table with, let's say, artificial milk. You may not know how to prepare the artificial milk, but if only breast milk is given to that child, the body has processed the milk, all the minerals, everything is there.
Yes, and you take the safe way.
Yes, your baby will be safe. Until 6 months, your baby can take other food stuff, because at that level, his or her immune system is able to fight against whatever obstacle that comes into his or her system.
Okay.
Thank you. And I would also like to tell young mothers, expecting mothers, that they should always go to their clinic, where they do the antenatal clinic whenever a labor starts, because it is very dangerous when you delay at home.
Thank you very much, Comfort, to that wonderful information and advices that you give or you gave to our young, maybe future mothers who are pregnant or
expecting babies.
Yes. So thank you very much even to accepting to be our resource person of today. I would like to extend some greetings to people you know, or maybe your family members or relatives. Can you?
Especially those that are listening to right now.
Yes.
I would like to say hello to my dear husband, Mr. Ngas Afraid.
Wow.
I would like to say hello to my father, Bobe Changa Isaiah.
Okay.
I would like to say hello to my baby.
What's the name of the baby?
The name of my baby is Bemsumbom Soles Tala.
Wow.
Hello, Tala.
Hi, Miss Comfort. I'm very happy that you accepted to be our guest on today's edition of You Drive. And of course, you'll be our darling wish next time to have you on the program. Dear listeners, we are finally drawing the curtains of this program, and you are listening to You Drive. And it is brought to you by the volunteers of Youth Outreach Program. If you want to reach us by mail, just go to the internet and type ydrive08@gmail.com. And of course, we encourage you very much to send your views through Facebook. We could always respond to your views. You could always give some contributions so that we could keep the show rolling, because the reason why we're here is because you are out there. And just type You Drive on Facebook, and our postal address is PO Box 5185 Nkwen, Bamenda. Or if you are interested to get more information about Youth Outreach Program, just go to www.yobcam.org. And if you want to pay us a visit, come to Ryan White House, Mile 1 Upstation. It's from Mile 1 Junction. Going to your right, you see a white signpost written there, Youth Outreach Program. I've been Eric Botiji, and I want to say hello to all the mothers out there. You guys are amazing. You guys cared for us when we were still small, and say, hooray, choose.
Yes, goodbye to you, and I want to greet my housemates, Laura and Eric. They are hopefully listening to me in this moment.
Thank you, Jay, friends of Youth Drive, for listening to today's show on maternal health. Next, we are going to bring another topic on the 8th Millennium Development Goals set down by United Nations on HIV and AIDS prevention. Yes. So I'm called Bukenina, and I want to extend my greeting to all my family members, especially my father, Mr. Kamayu George, my mother, Mr. Kamayu CV, and Laura and Eric from GIZ, Germany. So keep listening to good vibes on Foundation Radio. Bye.
Bye-bye. Have a great weekend.
The foundation for the younger generation. On the foundation for the younger generation. On the foundation for the younger generation.